Welcome to NCHE Presents, Leaders Pursuing Health Equity in America. Our nation is experiencing a strong movement for truth, racial healing, and transformation. This movement is advancing in communities, on college campuses, and in business sectors. America must acknowledge the truth. Racism has existed here for centuries, and we can redress it by healing the wounds of the past and charting paths forward that transform our society. Everyone must be treated with dignity and respect. In the NCHE podcast, we will lift up leaders who are finding innovative ways to generate healing and build the bridge to tomorrow. We will talk to leaders addressing the entrenched legacy of separation and segregation. We will strategize with those tackling the racist policies and legal structures that continue to impede progress. And we will hear from leaders working to create economic opportunities that can stabilize families. Join us on this journey. Here's our host, NCHE Executive Director, Dr. Gail C. Christopher.
Hello, I'm Gail Christopher, and welcome to this episode, to this podcast of the NCHE, focusing on leaders pursuing health equity. Our guest this week is Angela Austin, a Detroit native who's leading truth, racial healing, and transformation work in Michigan. Welcome, Angela.
Thank you for having me. It's good to see you, Dr. Christopher.
It's good to see you as well. Can you tell us about the work that you're doing and give us a little bit more about your background and why you're so committed to this work of truth, racial healing, and transformation?
Absolutely. Well, I want to thank you for inviting me into the work. And that's really where my story with truth, racial healing, and transformation begins. I work with racial equity and social justice, and racial justice has longer roots in my upbringing in Detroit and really understanding what the nonprofit sector really looked like and understanding how civic engagement and policies often work against the really important and passionate work that so many brilliant leaders are doing in community, and understanding that we have to actually get to the root, that we are having to really understand what's behind what we call our wicked problems, like concentrated poverty, generational trauma, and that we need policy that helps our communities heal. So I'm so grateful to be able to do that work and have carried your words with me for the past 6-7 years. When we talked about what does it mean to be truth, and I remember asking you, well, Dr. Christopher, everybody's truth is their own truth. How do you reconcile so many truths? And you were so patient with me, and you said there is just one truth, that there is one race and we are the human race. And I have carried that with me, and it has really guided the work in our community in the way that we approach healing together and understanding that we all have a part to play, and that it's through relationships that allow us to weather storms. And Michigan has certainly had its storms.
Wow. You know, you really embody the spirit of this work, Angela, and it's such an honor and privilege to be able to speak with you and amplify your voice and amplify the clarity that you bring to this work. You are correct. Michigan has had and continues to have its challenges, but, you know, on the heels of this past election, Michigan has had some pretty positive outcomes. And those of us that do work every day on the ground, I'm telling everybody I know to take a moment and exhale and realize that this heart-to-heart work that we've been doing, it had something to do with democracy surviving the challenge that it faced. What's your reaction to that?
My reaction is that we have seen people rise not just to the challenge, but above and beyond the challenge. those of us who have worked in racial equity and racial justice, we're accustomed to having some really challenging conversations. We're accustomed to a level of risk taking in our daily lives. But what we saw is communities really rallying and coming together and finding ways to intersect. We saw intersectional movement and multiracial movement in such beautiful ways, and really what are our common values. And it's just so reassuring to know that people of goodwill, that people who love justice, the people who love democracy are the majority.
And we are, and that is the thing that I keep reiterating. It's not enough, however, to just be a majority. We're going to have to be a supermajority, and that's why the work must continue. I've been so impressed with the unique and innovative ways that you have changed the narrative in your community. We know that narrative change is an important part of this truth work. Could you tell us some of the ways in which you have helped to drive a new narrative, a new understanding about equity and inequities right there in your community?
Yes, that's such a great question. I think one of the biggest narrative shifts in our community is just the ability to name that as much as we love one another, as much as this is such a giving and caring community, that what's underneath what we see as really consistent long-term problems where we see very predictable outcomes for certain demographics, for certain children, and really using our relationships and the stories that people hold from their lives and being able to lift up those stories so that people who may not live in those same conditions daily to really understand how systems that may benefit and seem to work for some people are actually quite harmful to others. So creating the spaces for those stories to be told, for people to be vulnerable with one another. So we have really embraced healing circles as a way for that deep storytelling to happen, building out a team of really caring people who have the will to hold these circles and to hold these spaces and to allow themselves to be a part of this narrative change is one deep way that we've done this work. And that's across different sectors with our youth, our teachers. At the height of the pandemic, there were nurses who really felt like they needed to be held in a sacred space, and the healing circles were a beautiful way to do that. And for us to really hear and to understand what it actually looks like when you are on the front lines. We are not always all on the front lines, but those stories absolutely should drive the way that we approach our work in policy and systems transformation.
Beautifully said. We each have a story. We each have an important journey, a legacy, a lived experience. And so much of what is used to drive policy decisions is missing that component. We are simply missing the lived experiences, the truth of people who are experiencing the weight, of our inequities. So we appreciate the brilliant approach that you all are taking to that within your communities. I recall hearing you describe how important schools are and how the community responds to the absence or the closing of schools, and what a powerful indicator and symbol that is of the disinvestment and the projector, if you will, predictor of what will happen to a community. Could you talk a little bit about the school situation there and the school closings?
Yes, and it comes from a story, the story of a 10-year-old boy named David in Detroit at a statewide gathering of our youth, because that for us is the core of our work and who we are building with for transformation. And when we asked David, what is the biggest impact on your life? What change would have the deepest impact? And he said, stop closing our neighborhood schools. When you close the school in my neighborhood, no one wants to live there. People move out, and what moves in is violence, it's crime, it's people who are struggling to actually have their needs met and who are self-medicating, and he saw the harm that just a simple school closing could cause. And so I say a simple school closing, but what we're really closing is an institution in the community.
Mm-hmm. I just remember how many schools were closed so dramatically in Chicago at one time, right? And to hear that wisdom from a 10-year-old, is just a reminder for us of what it takes to build community and how vulnerable young people are as we make these economic, and financial decisions, and we don't take into account the needs and the perceptions of the children. Could you talk to us about some of the more innovative things that you have tried, that you all are doing? I know you have an accountability project there that is unique and powerful, but we'd love to hear about your innovations.
Oh, thank you. It's one of my favorite words. And I'll tell you what, if the pandemic did nothing for us, it tested our ability to innovate. It tested our ability to be able to shift on the ground organizing, because we're very much a grassroots, boots on the ground, community-based organization. And it really required us to think differently about how we can actually continue to organize and be with our people and to create space. And so we hired a team of teens to teach us how to better engage with them, understanding that they were going to be in school virtually for the first time, how not all students, found that to be the best way to learn, how exhausting it is to be on camera all day. So they really helped us build out what a digital organizing platform looks like. And they helped us build it with such care and such love, and for their peers, because they designed it for their peers, so much so that our local program became a statewide program. It included participants from other states, and one whose parents actually made sure that they actually got to be here for the in-person action part of the program.
Wow. So now that's a powerful innovation for those of us who are leading nonprofit organizations. Let me be clear. You didn't volunteer recruit, you hired a group of teenagers to build out this platform. That is profound. Thank you so much for sharing that. And is it still in place today?
It is still in place. In fact, we took those lessons and have continued to build out our Freedom Summer Organizing School. And we're now exploring what it looks like to build out an ongoing year-round organizing school for youth around the world to be able to participate and to take those skills back into their own communities.
Wow. Can you talk a little bit about the barriers that you faced and overcame? I know you've already indicated some of it, but if you had to ask yourself, what is your greatest challenge in this work, particularly during these times, could you talk a little bit about that and how you're addressing them?
One of the biggest barriers, and I gave this some thought, is denial. We live in a very pleasant community. Many of our communities are very pleasant, and unless there is some type of polarization, which is what we've really been experiencing, is more and more polarization. And I say that that's not necessarily a bad thing, because we all get to do a gut check. We all get to choose, which side we want to be on. And I think we're coming to understand that, we actually do get to choose sides. And that's not always a comfortable place to be. And challenging people to be accountable often feels like punishment. It sometimes feels like an attack. And what we say is that accountability is actually an invitation to demonstrate your love. It's an opportunity to actually show people that you are who you say that you are. And so that's what we're really building with community, a space for those who ultimately are accountable for results, which is our elected leaders, our policy makers, folks that sit in directors' offices, when they see the data and they have to work on budgets and whether or not their budget is actually delivering any positive outcome, we want to be able to actually help them move the needle. I have not talked to any system leader who likes the data the way that it is, who is comfortable with knowing that Black and brown children have the worst outcomes for the community. But what we really need to get to is to get beyond the denial that underneath it all is a false belief in a racial hierarchy that is reinforced in policy, in practice, and in perception about what we believe people deserve, about people's ability to have agency in their own lives, and to determine what safety and health actually looks like for them.
Mm-hmm. Beautifully said, and so clearly said. And you gave me, as they say in the radio business, you gave me a nice segue into our next question, which has to do with data. I know you're a little bit familiar with our HOPE Data Initiative at the National Collaborative for Health Equity, how we've reframed that work to focus not just on the data about the inequities, but on the aspiration for how do we close the gap. Could you talk a little bit about how that applies to your work in terms of helping to drive the changes that you want to see?
Yeah, the ability to measure not just the work, because we can work and work and work and feel good about doing great things. And the question is that has it actually changed the material conditions of people's lives? Does it actually meet them where they live? Because that's how you build movement, is that the solutions that people want actually are showing up in their lives in ways that have meaning. And the HOPE data, we're relatively new to it, and it has really helped us to, in many ways, justify positions that we've taken to support the policies that we are really proposing and inviting the community to come in on as co-sponsors. So we have this vision of civil rights legislation of our time, that we will have this beautiful Breathe Act for Michigan that looks across all systems, and the ways that we have outlined truth, racial healing, and transformation, and these real pillars that need to be addressed and to be gotten underneath how we look at law, how we look at economy, and the data within those. And we begin to see that you can predict outcomes for entire groups of people, and to be able to measure whether or not we're actually moving beyond that, where those results are no longer predictable based on racial demographics. There are some surprises in Michigan data that we are really still wrestling with, because our furthest distance to goal is actually in the area of communities who actually live where there's low rates of sexual assault. And so that data, as we dig deeper into it and we look at who that impacts and our failure to protect women and girls in a post Roe v. Wade America, I'm so grateful that Michigan has done the work to make sure that folks who can get pregnant have the protections and the reproductive health care that they need.
Mm-hmm, mm-hmm. It's so wonderful to hear you describe the data within the context of accountability, because that's our 21st century horizon in this work. The 20th century was really about raising awareness and understanding and protesting and creating legislation that would give us our human rights and our civil rights. But I think the 20th century, the 21st century work is really about aspiring for equity, having measurable goals for equity and then driving toward achieving those goals. And to use the phrase that you use so beautifully, holding our leaders accountable for progress. Just, saying it's not acceptable, it's not permissible to continue to have these divides. So kudos to you as a leader And I'd really like to talk a little bit about some of the wisdom that your time as a leader, some of the wisdom that's emerging for you about leadership. I know that's kind of you didn't expect that question, but I really would love for you to share what are some of the key lessons that your leadership role is teaching you?
Well, first off, accountability starts with me. And I have to be accountable to the people who trust me, who, when I am in rooms, speaking about directly impacted folks, there are people who are far more directly impacted than I am. And really, that's who I'm accountable to. And that means that I have to be in relationship with people who have lived experiences, some of which I share, some of which are not a part of my daily life. And that means a level of humility. And I think what I've really learned is a lot more patience with people, that as much data, as many conversations, that people move at their own pace. People get to choose for themselves, and that everybody's journey looks different, and that we actually have to have really good tools, and we have to have people who are really committed to going the distance with people. This is lifetime work, and really what we're inviting people into, it's not a training. It's not an event. It's not a coming to a program. It is about how we do life differently together. To use the words of one of my sisters at One Love Global, it's how we do life together differently.
I love that phrase, how we do life together differently. Because, we're doing life in this context of a racial hierarchy. So this transformation is really about doing life differently. That's a powerful takeaway. Thank you so much for that.
I'll put it out there, and if you want to, we can discuss it otherwise. But you said in that room what a shame it would be if we were preaching to the choir. There was a small percentage of people in the room who identified as conservative, and that was right on the cusp of the 26 or just post 2016 election, and I know I was still, contending with the reality of how my work was going to change, in addition to my own personal life was going to change. And I still sit with that.
So, okay, we'll go there. The favorite phrase in the media these days, even after the outcome of the most recent midterm election, is that we are a divided America, that we are polarized. I want to take issue with that in the sense that we don't need to reinforce and totally embrace and accept that as our inevitable reality. We cannot continue to only be in our own circles, preaching to our own choirs. We really do have to reach across. And I'm wondering what experiences you may have had or be having in doing that in your work in Michigan, because Michigan's a very interesting place.
It's a very interesting place, and I'd say there's been some successes and some failures. And I also think, that's a part of accountability, is that we have to be willing to have conversations with people that we don't agree with, and always in the mindset that it's for deeper understanding. And so the healing circles and our touchstones, we talk about turning to wonder. And, how do we have conversations? I've had more conversations with people I don't agree with, who are extremely conservative. And I mean, in casual places, like on the plane, in a restaurant, those kind of conversations where people's guard is a little bit down. They're not in a group of people. They're not necessarily identifying any certain way. And I find in those one-on-one conversations that you can have a different kind of conversation. I don't know that people change their position or their view on things, but they do find that there's more to gain from having those kind of conversations than not. And also, I think it sows the kind of seed that actually you can kind of nurture. And my hope is that it sets them up for the next conversation that they have with someone who is kind of in that echo chamber, and that maybe some of the things that I've said, kind of come back up in their memory.
Can you really take us into one of those conversations, Angela? Can you give us a concrete sort of reflection of an instance like that? And I'm asking you to do that to sort of model for folks how that happens.
Yes, I had a conversation with a gentleman who had retired from the Pentagon and who was a staunch kind of law and order conservative, I won't say far right, but certainly right of center Republican. And, really couldn't see why the world was protesting against police brutality. He simply did not grasp it. It was not a part of his reality. It wasn't a part of his ideal of law enforcement. He was deeply hurt and offended by the criticism. And it took him hearing a perspective of what it's like not to know, just by nature of someone's uniform or badge, whether they are coming to help you or coming to hurt you. And that the idea that police are first responders and protectors, is not everyone's reality. We're all conditioned to kind of have a belief about policing and law enforcement that doesn't measure up to the reality for many people. And he really needed to hear that from somewhere other than the news media that he was getting information from.
Did he indicate appreciation for that perspective?
He did. He actually expressed great remorse and sympathy. And he absolutely felt for the parents, like what it would be like as a parent to lose a child to police violence. It hit home for him as a parent.
So our goals of deeper compassion, deeper empathy, our tenet about the power of story and personal connection, it was all embodied in that encounter, in that interaction. So thank you so much for sharing that, Angela. If you had some wisdom to leave with the audience today that would help to give them hope that we are moving in the right direction, what would your final thoughts be that you'd like to share?
I would say that, we're TRHT healing. This is a movement, and movements are built on organizing. And at the heart of organizing is relationships. It's about how we show up for one another, how we listen deeply to one another, and how we find ways to take action together. And we're seeing more young people, more intergenerational movement, more multi-racial, more cross movement. So we see people coming together across issues and really understanding that what happens in the law system impacts what happens in our education system, and even what happens in our health system. As I'm hearing more stories about, what happens in emergency rooms and what happens, on the front lines when there's a shooting in a community, how all of these systems collide with our young people. So I just say that there's hope in the ways that people are coming together and building strategy together is beautiful. And I'm really excited to continue to do that work.
Thank you so much. And I'm excited for you to continue to do that work. You are an amazing leader, and it's been a privilege for us to have this limited time with you. in our podcast, but I hope it's the first of future conversations. Once again, appreciation, and we'll talk again soon.
You've been listening to NCHE Presents, Leaders Pursuing Health Equity in America, a podcast hosted by Dr. Gail Christopher, Executive Director of the National Collaborative for Health Equity. Through resolutions, executive orders, and other mechanisms, local leaders are declaring racism a public health crisis and committing to addressing systemic health and racial inequities. Follow NCHE on all social platforms and visit nationalcollaborative.org to learn how you can implement truth, racial healing, and transformation in your community.